Entering an accurate medication reconciliation is more important with electronic ordering. Information entered by nursing is what the provider uses when he places his orders. You should observe the 5 rights of medication administration when entering MedRec. Be sure you are entering on the right patient, the right drug, the right dose, the right route, and the right frequency or direction. To open MedRec, select Meds and begin typing the name of the medication you want. In this case, the patient states they are taking low pressure 50 milligrams BID. Notice that the low pressure tablet does not display. If you're unable to locate a medication by the trade name, try searching under the generic name. Notice there are 2 different metoprolols. Select the appropriate, extended release or the regular tablet. Make sure I'm selecting the right drug, the right dose, the right frequency. If that is correct, click Select. Enter your last taken information. This patient reports taking it this morning at 7 a.m. The next medication, Diovan HTC 320-25, taken daily. Notice you have multiple strings. Be sure to select the appropriate string for what the patient reports taking. If all is accurate, click Select and enter the last taken information. The next medication is Coumadin 2 milligrams, only taken on Sunday, Wednesday, and Saturday. Notice there are multiple doses of Coumadin selected. Be sure to select the appropriate strength. In this case, 2 milligrams. The patient reports only taking it Sunday, Wednesday, and Saturday. Alter the daily dose and enter the first 2 letters for the day of the week. Sunday, Wednesday, and Saturday. Select OK. Select and complete the last taken information. The next medication is Norco 5/325 as needed for pain. Your patient reports taking as needed for pain. You will need to question further to find out the frequency that they take it. Q6 hours, Q4 hours, and alter this accordingly. Select PRN by clicking and entering the reason for use. You may use the type ahead search to select. And complete your last taken information. Your patient reports digoxin 250 micrograms. Notice there are multiple digoxins listed and different forms of the medication. Be sure to select the appropriate form. This patient is taking 250 micrograms oral. Notice the ampule and the tablet. Selecting the ampule would indicate that the patient is taking this via injection. Your patient also reports taking Levemir, 30 units AM and 35 units in the PM. Select your string and alter the dose. In this case, the patient is taking 30 units in the AM. The patient is also taking 35 units PM. This needs to be entered as a separate selection and complete the last taken information. Note, comments entered here do not appear to pharmacy or to the provider. These two should be entered as two separate orders so that they may be continued appropriately. The next medication is Humalog on a sliding scale. Select the appropriate medication. Under dose, enter a 0 dose. This will prompt the provider that that medication will be a sliding scale. Enter the directions. Click on the Details area and enter the sliding scale information underneath Patient Instructions. Select Save and select. Enter your last taken information. Lastly, the patient reports taking Synthroid 175 micrograms. Notice the multiple different strengths of Synthroid. Be sure to select the appropriate strength. Selecting an inappropriate strength and altering the dose will result in dispensing multiple tablets or calling for fracturing the tablet and administering half or quarter tabs. Be sure the frequency is appropriate. Once you've completed all of the medications, select Save. You may review your entries here. Notice that your sliding scale information is viewable. If all is correct, file and exit.